WIS is a platform. We're all familiar with platforms. We use Google, we use Facebook, we use Twitter. These are digital platforms. So when I say a platform, you automatically think, oh, that's a digital platform. This is far better than a digital platform. This is meaningful interaction as a community on a social interaction level. So it benefits everyone. This platform is for 7 billion people. It has a great opportunity to bring people together, to tackle social isolation at the same time as we grow our economies for sustainability and regenerating communities, from children in the schools with kids to our senior citizens with seniors. We all work together collectively. That's the beauty of this program and this project. It's there for everyone. We've brought it from a tweet to now on the international stage. You know, we've spoken at Davos. We're supporting the Sustainable Development Goals, their implementation in 25 cities worldwide. It'll impact over 100 million people. This is just the start. Where we see ourselves in the future is growing and evolving and supporting communities worldwide in your local community, making a difference on that circular economy model, generating income streams, but then reinvesting it back into the community. But the ownership is with the local community, so it stays local. Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit. Absolutely delighted to welcome you to our SDG 3 Good Health and Wellbeing student webinar. And we've got a packed agenda today. Very much looking forward to hearing all our experts' opinions and also listening to students from around the world give their insight into how they can support the Sustainable Development Goals. Let's jump into the introductions, and perhaps Bogdan, you could start us and just tell us who you are, where you're working.
Pleasure to meet you all, and thank you so much for setting this up, Gareth. It's a huge pleasure to have so many of you joining us live as well. And if you've got any ideas, do get in touch with us. My name is Bogdan. I'm the founder and chair of the Social Prescribing Champion Scheme, and I've had the great pleasure of working with so many of the people involved in this panel, and hopefully we'll share some inspirational stories from all over the world with you shortly. But you're in for a treat because we've got some amazing speakers on the panel today, and I'll let them introduce themselves one by one.
Anya, it'd be great to hear from yourself.
Thank you very much, and echo Bogdan's words about the privilege of being able to share this afternoon with you all. My name's Anya. I'm an occupational therapy student and also working with NHS England in the UK around personalised care.
And we've Dr. Mike Dixon.
Hi, I'm a GP, general practitioner and a family doctor. I chair the College of Medicine, and I'm also chair of the Institute for Social Prescription here in the Southwest.
Thanks, Mike. Daisy.
Hello, everyone. It's an honour to be here today. I'm Daisy. I am the lead of the Social Prescribing Champion Scheme. I work closely alongside Bogdan, and I'm a medical student at the University of Exeter.
Thanks. And they're just literally short introductions. Let us go straight to Mike. And Mike, perhaps you could give the audience, and for those listening on podcast, an insight into social prescribing. What does it mean? And also, how can healthcare systems look to the future and embrace this, particularly on the back of COVID-19, when we see, shall we say, the challenges that the health services are facing, and also looking to the future, you know, with 18 million staff short, the world's economies need to look at how do we promote good health and well-being.
Gareth, very good question indeed. And I think very essential to the future. So social prescription is really a very simple concept. It's about having someone who refers, often a family doctor like myself, but it could be anyone in primary care, secondary care, or even the patient himself, referring them to someone called a link worker who has time to really understand where that person is, what their aspirations, hopes, challenges are, why they are feeling how they do. Often these will be people who are really on their downmost point, either mentally or physically, and then provides them with an intervention that is very much bespoke to them, which will change things in their life. Now, that might be, at one level, simply benefits advice, employment advice, better housing, but increasingly other things like joining various social groups or acting groups, befriending groups, could be music, arts interventions, it could be green exercise, a whole range of things that are no longer just simply pills and prescriptions. So on the face of it, that's an individual intervention, often for those in the most need, so attacking the inequalities agenda, also demedicalising the way we offer care. But on another level, this is part of a fundamental social revolution, because the more that social prescription takes off, and the more the voluntary and volunteer effort develops in the community, the more that community changes itself, the more it builds up social capital. So if you go, for instance, to somewhere like Frome here in Somerset in England, not only do you have your social link workers connecting people up to a whole range of activities that will keep them well and help them to get better, but there you've got 1,000 what we call community connectors, who are people in the community, people who might be, they might be taxi drivers, they might be working in the supermarkets, they might be students, they might work in the post office, who are connecting the community up. And increasingly what we're seeing in social prescription is that the link worker and the prescriptions leading to a whole range of extra volunteer and voluntary activities, and much greater connection within that community between the local authority, between primary care, and between the voluntary and the VTSE sector. So it's really about an individual intervention, but with enormous consequences in the community in terms of sustainability, because the only way that health systems or communities themselves are going to be sustainable are if we put our own effort as individual citizens and communities into the good of other people, and particularly the health service itself.
That's a huge opportunity, Mike, isn't it? In terms of value creation, I mean, the health system is built around a whole model which is then, defined as cost, value for money. We hear this all the time. However, what you're talking about here is using a community as a way of leveraging new value creation, which can in turn create new opportunities and jobs. It really is massive.
It's a massive agenda with what economists call a multiplier effect. The ripple effects of social prescription are what we're finding. So to begin with, your government is saying, well, does it work? Well, obviously it works, really, because it's almost intuitive that sweating local resources and using the community and individual as assets is going to make sense. However, the way we measure it is often rather linear. We simply look at the effects on that individual patient at the end of the intervention. But of course, what we should be looking at is what's happening within that community. How is that changing? How are people's attitudes changing? Are we getting less young ladies self-harming? Are we getting less elderly people feeling socially isolated? This is the enormous gains to be made. And I often call social prescribing a Trojan horse. It's almost going into communities and going into primary care with a different idea, but which is creating all sorts of ideological and practical changes in what happens.
Yeah, absolutely brilliant, because when you look at the structural capital, for example, with the NHS in the background, you can amplify that 100-fold. So what an opportunity for the UK. Anya, if I bring you in, perhaps you could, just from an OT's perspective and working in the community setting, can you give us examples of some of these opportunities that are out there?
Yeah, of course. Thank you. And thank you to Michael for such a helpful introduction. I think there's such an exciting area around social prescribing. And I think one of the things that particularly excites me as a student is this idea that we've got these link workers who are people who really know the ins and the outs of their local community and have a fantastic kind of wealth of knowledge. I often talk to them in terms of like our kind of secondary care consultants in an acute hospital, but actually they're the equivalent of that in our community. They've got the knowledge of all of those resources. I think there's also a tension here as well. So we've got these link workers, and there's a risk that we think that it's their job. And actually it's both everybody's responsibility and also a link worker's job. So I think one of the exciting things, particularly for students, is recognizing these link workers, social prescribers, community navigators, whatever they might be called in our local area, and making sure that we're able to understand their role and their contribution to the MDT. Because certainly some of the work I've done in the past, and MDT has been kind of considered as a concept restricted to those who've got registration. professional qualifications, and actually some of these emerging roles can make just a valuable contribution to that as well. But then there's also recognizing that we don't always have to refer to a social prescriber if actually we've got some of that knowledge ourselves as well. So we might not necessarily expect a physio to know the ins and the outs of the local bus timetable and exactly which day which village hall is operating what particular group, but actually knowing, for example, that there's a local park run that's available, or perhaps a local versus arthritis group. So there's some kind of general, and that comes under this umbrella of active signposting. I think it's this continuum of social prescribing where we've got some quite very brief building on things like the Making Every Contact Count programme in the UK, where actually it's all of our responsibility to do this really, really well. And we can all have that impact to start to unlock some of those opportunities that Michael talked about. But we've also got the opportunity to work really well with some of these specialist roles to be able to influence that. And I think every profession will feel that there are bits that they do. So there's certainly elements of social prescribing which overlap really well with OT. And I'm sure lots of other people within the allied healthcare professionals and other medical professionals also feel that. So I think it's this case of kind of collaboration rather than competition to make sure that at the end of the day, we're getting the best for the people that are accessing our services.
I love the way you were able to bring in park run and even the likes of buses, for example, because all of those things link into sustainable development goals, particularly around climate change, for example. Is the bus a diesel bus? Is it emitting fumes? That inflects on our air quality, which is all health related. So I love the way you've brought that into the conversation. Daisy, from your perspective, I'd love to hear your thoughts around social prescribing. Where do you think the opportunities are?
Yeah, I love social prescribing, and I think we've come to a really important time where we're trying to get social prescribing not only into secondary care, but also into the curriculum. So as part of the Student Champion Scheme for the past few years, we've been working on getting social prescribing into the curriculum at medical schools, so specifically for medical students. And the reason why we started with medical students is we found that actually they really didn't know what social prescribing was. So 3 years ago, 93% of medical students had never heard of it. And now actually we've come to a point where it's integrated into a lot of medical schools, thanks to the work of our amazing student champions, and thanks to the medical schools for integrating it into their curriculum. So now our goal is to sort of not only focus on medical students, but try and get it into the curriculums of lots of other courses, so allied healthcare professionals, nursing, etc. And kind of we want to get students to work in an interdisciplinary manner on social prescribing.
Absolutely, and we'll have some of those students join us very shortly. Bogdan, you've been championing, social prescribing. Give us an insight into, from your perspective, what you think the future holds and the opportunities, particularly using the SDGs as a way and a means to broaden the scope of what the UK has started around social prescribing.
Absolutely. No, it's fascinating because I think the SDGs provide a universal language that we can all use from wherever we are in the world to collaborate on this international movement. And as Dr. Dixon was saying, it's a true social well-being revolution in that sense. From my perspective, if we put aside the acute COVID-19 pandemic and you try to look at the long-term picture in here as well, in simple terms, there's a big problem that we're facing. So 21st century demographic changes have meant that we're living longer than ever before. And technology is allowing us to enjoy good health for longer, which is great, and we should celebrate that. But I think as we live longer, chronic diseases are on the rise as well. We're facing an obesity crisis, a mental health epidemic, loneliness crisis, and it's only going to get worse. And so the big problem is that the population is about to double, really, about 2050. And whilst healthcare professional numbers remain the same, and so we're slowly going to be overwhelmed by the amount of chronic diseases, if you like to think about it that way. Not to mention that a large chunk of the population, so approximately 1 in 4 people, will present for non-biological reasons, which are, for example, psychological or social in nature. And so the sad thing is that we're still being taught to react to diseases and to think in algorithms and put labels on patients instead of empowering them to contribute and collaborate with us. I think as a junior doctor, I can say that the big problem is we live in a country or a century, really, because it's not a UK-based problem, but a global problem, where telling patients what to do, not only that has become inappropriate in a sense, but will also become impossible given the numbers. So the real question for me is, how do we move away from a system just focused on treating illness towards one that is based really on promoting well-being and preventing ill health? And so we need to consider wider determinants of health, of course, and health behavior, lifestyle, places and communities we live in, as Dr. Dixon and Anya and Daisy were saying as well. So I think this is why my obsession with the biopsychosocial model, and that's where it stems from in a way as well. We seem to be good at biological side of things and biological side of the model, but the psycho and social, not so much really. And so if our values and beliefs and perceptions are rooted into behaviors that we set over time, I guess we need to change the narrative. And if we want long-term change to occur, we really need to dig deep down at the root cause and support the future generation to adopt new values, beliefs, and perceptions. We need new values that revolve around the health of our community. As you all said, inter and multidisciplinary collaboration and learning, prevention, and accountability. We basically owe the future generation of students and healthcare professionals and the support required to grow. So I guess what happens when students are nurtured, mentored, and supported to play an active role within their local community? Well, it's a great joy to have with us today here a bunch of students at various stages of their careers, some younger than others, but they're from 12 to 13 different countries around the world, and I hope you'll be inspired by their presence. So we will first head to Japan, and I hope we got Taiki with us here. Taiki, are you there? Perfect. Tell us about yourself, where you're from, and about your project.
Hello, my name is Taiki. I'm from Japan, Sophia University. My project involves developing a counseling method integrated with mindfulness that is sustainable and accessible for the public in order to overcome the issue of mental health. And I've supported the local communities through applying this project in my high school. And I'm very honored to receive an award for it in Harvard. And in the future, I'm planning to create a manual for my counseling method and expand the scope of contribution. Thank you very much.
Fantastic, Taiki. That's a brilliant opportunity. Thank you so much. And can I just remind students as well that as soon as you finish talking, you can just join the live link as well, just so that we create space for more students, because we have a bunch of you in here as well. So next on, we're going to Northern Ireland. So back into the UK at the moment. Katrina and Peter, you're up.
Hi everyone, my name's Katrina.
And I'm Peter.
And we're both medical students from Northern Ireland, currently studying at Queen's University, Belfast. So we're both involved with the student programme, and I'm currently the regional lead for Northern Ireland. I've been introduced to many of the current social prescribing projects at the moment in Northern Ireland, including the Mid and East Antrim Age Well Partnership, which aims to improve the lives of older people in the local vicinity. And there's also a software company called Elemental, which allows GP practices to connect patients with local services across NI. Part of the success, of course, of social prescribing in Northern Ireland is down to collaborating with others around the world and sharing all of our ideas. So Peter and I were lucky enough to both be involved in the second annual conference for social prescribing before, of course, everything was moved online due to COVID.
So we're both involved with the conference along with Elemental and other UK leaders in social prescribing, such as the Bromley by Bow Centre, which was a fantastic experience. During the breaks, we both facilitated a large group art project where everyone came together and added to a large canvas, and it was then revealed at the end of the day to be a pair of hands, one helping the other, to show the power of collaboration that's really at the heart of social prescribing. We've since published an insights article along with other students on the event with our reflections on the day.
So since then, there's been a huge enthusiasm for social prescribing to be included in our curriculum for medical students. And I'm very happy to say that this is the first year that it's been implemented. And we've received very positive feedback, starting with the first year students, the majority of which who had never heard of social prescribing before, but now they believe it is an essential element of medical education. So we hope to continue to expand this awareness of social prescribing within Northern Ireland, beyond the medical community, and enable patients to be fully aware of all of their local treatment options. Thank you.
Brilliant. Thank you both. You're both absolute stars, and you've done some amazing things. So we're now back to Asia at the moment, and we've got Iongh with us from Thailand, actually.
Hello everyone, my name is Yihan. I'm originally from Taiwan but currently living in Bangkok, Thailand. My project involved me writing and illustrating a cancer book to support children in understanding about cancer and to break down the stigma around the disease. I hope this book will help young cancer patients and also children who have their loved ones diagnosed with cancer. Yeah, and thank you for having me.
Thank you, Ihan. Thank you so much. Ihan's book is going to be published and hopefully inspire others and also will help more children as well in that situation. We're going back to the UK now. So we've got Anya from Scotland at the moment. We're doing it back and forth throughout the world.
So yeah, hi, I'm Ronnie Fernandez, a medical student at the University of Dundee. Since 2019, I've also been the regional lead for the scheme in Scotland. I recently led a team of 7 student champions who are keen to look into how the COVID-19 pandemic affected the delivery of social prescribing services across the UK, and in turn, how the service helped alleviate issues like loneliness and anxiety that were at an all-time high, especially during lockdown periods. So we designed a national study with 19 Likert scale questions, 2 open-ended free text questions, and targeted GPs, link workers, and anyone that might be involved in social prescribing. We garnered 224 responses and over 2,000 lines of free text responses. I wish I could condense all of that for you today, but our key points were that patients found the service incredibly helpful, from finding online resources that replace community activities to accessing financial advice or even receiving food parcels when they couldn't go out to shop. This sentiment was echoed by GPs who reported better patient outcomes following a referral to a link worker. Overall, the significance of social prescribing in our communities has never been more obvious than it is now. And someday I'd love to talk you through the rest of our data to substantiate that statement. Thank you.
Thank you so much. That's fascinating. Thank you, Ree. So next we've got Zainab and Fatima telling us about their initiative in healthcare literacy.
Hello, my name is Zainab Jama and I'm a final year biomedical sciences student at Queen Mary University of London.
Hello, my name is Fatima and I am recently graduated from a degree in neuroscience from King's College London, and I currently work as a research technician in a neuromuscular diseases lab at UCL. Together we have created a project called ISHA, which aims to improve the health awareness in the British Somali community. We were inspired by the mass spread of misinformation regarding the coronavirus pandemic, which was circulating on social media platforms such as WhatsApp and Facebook.
We post educational videos on social media platforms such as Facebook, Twitter, and Instagram, where we break down complicated health information such as what a vaccine is, what's inside a vaccine, and how vaccines are developed. We hope to be able to empower the Somali community to make better decisions about their health, and hopefully we can further push this project. So far, our videos have gained over 12,000 views, and we hope that this can be spread across the UK as well. Thank you.
Brilliant. Thank you both and good luck. It sounds like an amazing opportunity. Next up, we got Steve representing India.
Hi, good evening. My name is Steve and I'm a year 12 student from India. In response to the floods that occurred in October 2020 in Hyderabad, India, and after hearing of the misery caused by these floods from relatives and friends in India, for example, 100 deaths, 40,000 families displaced, and damage caused that was worth $680 million, I decided to start a fundraiser and donate to NGOs to provide relief to flood-affected victims. Though this catastrophe may have taken place a few months ago, the effects of it still remain. There are over 100,000 victims who haven't received adequate help from the government. And this news really saddened me and motivated me to do everything I could to help these victims. As a citizen of India and as a native of Hyderabad, I felt the moral responsibility to help the victims to the best of my ability. So far, we have developed a fundraiser, as well as a website and social media page, and we aim to project it as much as possible to gain as many donations to contribute to the relief of flood victims. And that's pretty much my project, and thank you for giving me this opportunity and the platform to share this need.
Thank you so much, Steve. Highly inspirational. I do wish you all the best with the campaign. Next up, we're going to New York, actually, in the USA. One of my good friends, Paul. Thank you so much for joining us, Paul, as well. And over to you.
Hello. It is an absolute joy to be here. I hope you're all well. My name is Paul Lewis. I went to Harvard College for undergrad, and I'm currently a medical student at Columbia University in New York. As so many of you have already stressed today, students have tremendous potential to be civically minded leaders, since have a desire to make an impact, and they can greatly benefit from having role models and mentors who can help guide them to not just make a project, but to make sure they are evidence-based cost-effective initiatives. While at Harvard, I started a global health conference and brought it with me to medical school, now called Global Health Organization International Young Researchers Conference. The IORC is essentially a platform for creativity. It's a program that brings students from around the world together to create projects that tackle the multifaceted topic that is global health. Students get to engage in research, tell stories, and engage in communities. They have ample opportunity to think, analyze, and learn. Research is at the center of our initiative, as evidence-based work is critical for actually making sure our initiatives are benefiting the communities we work with. Most high school students aren't taught how to read or write a manuscript, so it's quite ambitious to get them comfortable with research. But we think it's an extremely important foundation that helps them understand what a journal is, how an article is structured, etc. Students then go on to step further to create community projects where they choose an issue in society that they're interested in, read more about it and what has been done, and engage with that issue in a concrete way. That can be raising awareness, volunteering, or creating a program. It all depends on the student's interests. We help build a foundation of how to conduct a project ethically in an evidence-based way, cost-effective, and community-involved manner. We look forward to the projects of our students, and thank you for having me today.
Thank you so much for that, highly inspirational. Just to show how the small the world is, actually, at Paul's conference at Harvard, Taiki from Japan presented one of his award-winning projects. And so it's highly inspirational to see how people meet that way as well. So next we're off to Greece. So Rosette Kalispera, I think you say down there. Tell us more about your project.
All right. Hello, everyone. My name is Rosette. I am from Greece. And I helped develop a quality improvement project for heart attack recovery. It was led by junior doctors in the UK, and the aim of the project is to help patients identify the potential symptoms of heart attacks, but also the different steps they have to take once those symptoms have been identified. It also has the aim to dissipate some of the misinformation around heart attacks and to provide patients with the necessary resources for the long-term recovery, including resources to help with the psychological and the physical impact. Some of the resources are in the form of support groups, but also social media campaigns.
Thank you so much. Fantastic. We're now going to move into Wales, and we got Lavinia joining us from Wales. Lavinia, are you with us?
I am indeed. Noswaith dda. Good evening from Wales. My name is Lavinia Porter. I'm a third-year medical student at Swansea University, and I represent a group of 7 students working to support social prescribing in Wales. Our main projects focus around integrating social prescribing education into our curriculums. So far, we've been successful into getting that solidified into our first-year curriculums in Swansea and Cardiff Medical School. We are also working with the Welsh Social Prescribing Research Network to support some of their activities as well, with the aim of unifying and supporting research between social prescribers and also the third sector organisations that support their work. One of the latest projects that we're working on is to try and understand the attitudes and understanding of social prescribing amongst clinicians and other allied healthcare practitioners, including nurses, occupational therapists and physiotherapists. So that's what we'll be doing over the next year or so. Thank you.
Well done for all the hard work. Next off, we're in UAE, but with a project in Lebanon, actually, with an enthusiastic student called Tamar. Tamar, tell us about your project in UAE / Lebanon, Beirut.
Thank you, Dr. Bogdan. Hi, everyone. I hope everyone's safe and healthy. I'm Tamar. I'm from Lebanon, and I'm currently a student in Dubai. And my project was providing sanitary pads for women in Lebanon. I think we all know that Lebanon has been through quite a few challenges, from their economic meltdown to the recent Beirut explosion. And so I really just wanted to do anything to help the people. And I found one of the many overlooked issues there is women's hygiene. And so I wanted to do everything in my power to help these women, because I do believe that women's hygiene isn't just physical, it couldn't just cause physical damage, but it also is a lot of psychological damage, you know, dignity and pride. And so that's my project, and I've been working closely with Ajalina, that's an NGO down in Lebanon, and the Red Cross.
Fantastic. Thank you so much. Highly inspirational, especially as you all come from all over the world as well. Next up, we're actually back into the US at the moment, so Boston, Harvard as well. Vashni, over to you.
Thank you so much. Good morning, good afternoon, and good evening to everyone, depending upon where you are located. My name is Varshini. I'm an undergraduate student at Harvard studying social anthropology and neuroscience. I'm really humbled and excited to speak to you all today. Currently working with Bogdan and performing research on social prescribing models in different countries across the world, especially since social prescribing has taken so many different forms or lack thereof in other areas. In the US, the social prescribing model is often referred to as this biopsychosocial approach and often really heavily studied from a medical anthropology standpoint. And I'm really interested in understanding how we can really unite all of these different approaches into a universalized language, as Bogdan describes it. And so my passion for all of this work really stems from my mission in empowering young women in rural areas across the globe. And so I've been working on a project to support young women through Sparking Lives, which is a nonprofit I've been working on, whose mission is to basically provide equitable medical care, educational resources, and mental health campaigns. And so I've been working with the UN Millennium Fellowship, as well as some other projects, to really work on how we can give voices and amplify the stories of women across the globe and conduct medical camps providing free care to all. And I'm really excited to be involved in this global social prescribing scheme and advocating for this campaign. And I believe that together we really have the capacity to create real change. Thank you so much.
Fantastic. Thank you, Varshini. Thank you so much. And so hopefully we've got on the chat as well, I've got Isabella representing Philippines as well. I'm not sure if she's with us today. Let's have a look. And if not, Ekaterina, Russia, if we don't, I'm sorry, we missed you both. But can I just say, I don't know how you all feel about that, but you know, when there's people pointing fingers and blaming and doing different things, and then you have these students who are simply just buzzing with interest and energy and enthusiasm from all over the world, I think it's a true inspiring movement. And I hope many of you will resonate with them, and I hope many of you will try and support them as well through their project. Oh, I think we've got Isabel as well. Fantastic.
Hello.
So representing Philippines, we got Izzy as well. Izzy, over to you.
Hello, I'm Isabella Bonifacio. I'm from London, but I was born in the Philippines, and I'm currently studying biomedical sciences at Queen Mary University London. My project is a sub-branch from Zainab, so at the moment I am representing the Filipino community, and we are making posts which allow the Filipino community to access health information in our language, so it's understandable for us. At the moment, a group of us from different universities, so Nottingham, Cambridge, London, and Portsmouth, are helping form posts. So we're translating, we're finding information that's current to the current healthcare climate, so everything regarding COVID and diseases that are prominent in our own community. Because everything is in Filipino, we can also overcome the language barriers, any misconceptions that might have been a result of language barriers, and also false information online. On top of that, because all of us are from different universities, we're hoping that by sharing our posts within our own separate local communities, we can make an impact on a national level by starting on a local level. Thank you.
Brilliant. Thank you so much, Izzy. Fantastic. So that's another brilliant, project on healthcare literacy as well. And over to you, Gareth. I think we've got some questions as well.
We do indeed, and I think what an inspiring group of people around the world who've joined us. And I just had a couple of questions that have come in, and perhaps Mike, one of the questions that came in here basically was asking, how is social prescribing viewed amongst the current healthcare professionals? And maybe you could perhaps give us an insight into that. I think you're on mute.
One second, Dr. Dixon. We can't hear you. I think you're on mute.
I'm sorry, forgive me, my IT. Before I answer, I just want to say what fantastic presentations they were. You know, an explosion of imagination and ideals, which are so crucial at your stage in medicine, and which show, you're already showing you can make a change, you know, make the difference, and so important for my generation to see this, you know, you are the future. But in terms of social prescribing, well, to begin with, I mean, even my own GP practice, they used to call me the vicar. They thought this is completely unrelated to what doctors should be doing. Now, they are converted, most of my peer group, when they actually come into contact with it. When they find that those unproductive conversations with a patient who has a social problem, where neither the doctor nor the patient benefited from it, when they find actually something's being done, something's making a difference, and it's having the ripple effects that I described earlier, they begin to believe in it. Firstly, simply because it actually eases their time and they've got more time for other things. But eventually they get it. They get this whole, this whole idea of the psychosocial, this whole idea of community, this whole idea that, as doctors, we need to get out of our surgeries, our rooms, and actually be part of that community, making a change. So we're finding an enormous change. There are plenty still who are absolutely stuck in the medical mold, that really think this is nice, but slightly fluffy, not terribly important, and certainly not the main job of giving out tablets and procedures. But the revolution is there. Certainly in the UK, I mean, social prescription is now universal in every primary care network. We're going to have 2 or 3 link workers in every primary care network in the next few years. And I would say that the profession, all the professions, are now converted. And, I think what Daisy said earlier on, speaks it all. In the old days, medical students didn't know what it was. Now most of them do.
Fantastic. And Anya, we had a question in, how do you think social prescribing will help elderly people who are constantly scared due to the ongoing pandemic? That's a very important question.
Yeah, really, really topical, isn't it? I think one of the things I think that social prescribing has a real power to do is to support people's confidence. And unfortunately, confidence doesn't come out of a pill packet. You can't take something once a day and suddenly you feel confident. So I think one of the things we've seen, certainly, I think, it's been kind of in the blood and the DNA of the voluntary and the community sector, is their ability to adapt and their ability to innovate. We've certainly done that at an extraordinary pace over the last year. So I think there's lots of different ways. I think some of the traditional examples of social prescribing that we might have shared sort of 2 or 3 years ago are obviously not available at the moment in the current lockdown situations that they're in at the moment. But I think we've seen the importance of that ability to be able to connect, which I think is really important. And then just, if I can very quickly just pick up on the point that Michael made. So there's something here about kind of social prescribing as a way to demedicalize things. I think it's really important that we make sure that we're thinking about this beyond the medical professions and thinking about kind of allied healthcare professionals as well. One of the challenges I hear around social prescribing is that it's almost like asking our clinical colleagues to be simultaneously healthcare professionals, counsellors and social workers. And I think it's about understanding this is not about asking us to suddenly train in 3 different disciplines in parallel. It's by expanding that approach, of that networked approach, so that we all came into healthcare to help people. This is another tool in our toolbox to support people. And I think that's just my final point on that one. Thank you.
Anya, I totally agree with you. It's the reason why we joined the health service, certainly from my perspective, many moons ago, was to help people. That's what we're here to do. Daisy, from your perspective, we've heard around the world this social movement that is now in motion, shall we say, that the opportunity is there to build back stronger. The next 12 to 24 months are going to be critical. Where do you see these opportunities evolving? Do you have a particular word of advice for anyone out there listening to get involved?
Yes, so at the moment we've done a great job in getting social prescribing into primary care. So through the integration, at least in the UK, into the primary care networks. But at the moment, we are sort of looking towards getting social prescribing into secondary care. And I think that's really important. And that's where that multidisciplinary approach comes into sort of focus. Like Anya was saying, consultants operate in secondary care hospitals, whereas community navigators, link workers, social prescribers operate in primary care. But one of the things we really want to do is to allow sort of the multidisciplinary team in hospitals to be able to refer patients into social prescribing from the hospital, to allow that connection to grow between primary and secondary care.
Bogdan, if I come to you, I might touched on it, Anya's touched on it, so has Daisy touched on it. Encouraging healthcare professionals to look at social prescribing as an opportunity to create something outside the medical space. can also be an opportunity for governments to look at job creation in the future and creating new value change and new ecosystems. Because one of the things I think that we're not really particularly good at is measuring the value of health and well-being. And I think with the pandemic, we've seen the huge cost that this has caused our economies, and really that old saying of health being wealth. There's an opportunity really for the students around the world to kind of embrace this, and then also change the mindset from what we've had in the past, which is pathogenic, to a salutogenic, which is a well-being focused, shall we say, outlook. Do you think that the students can step up to that challenge? Will they be able to drive that agenda?
Absolutely. So I think that's especially this is all about. I think this is all about the students from all over the world, and the healthcare students, regardless of being medical students, OT, PT, pharmacy, nurses, all of them need to get together and use this universal language. And I think this is where the SDGs come in as well. And I believe that by championing these areas of health and trying to move away from that model where we tell patients what to do, we put them into boxes, we diagnose them just and put them labels on them, to move to a point where we can teach them and work together with them and share that knowledge, and not be upset, for example, when somebody brings a phone and Googles some symptoms, but rather support them to find the perfect information. And as well as supporting communities, I think you mentioned something really important in there, and on how we can maximize, the community assets that we have. I think one of the most upsetting things is that sometimes it's just being seen as leveraging the community rather than supporting communities to develop. So I think there's an argument to be made for this, and I think we really need to support communities around to have those resources, but also to prove that we're trying to develop communities and work together and to form grassroots movements together with the communities, and not using the communities just for the sake of using the resources, but rather growing together. I think academic institutions across the world provide the golden opportunity for me. Students, if you think about it, regardless of what course you do, you will end up staying for 2, 3, 4, 5, 6 years in the same region. Why not enjoy the journey along the way and forget about that piece of paper that you get at the end of 2, 3 years, and simply get involved in supporting your local community? And I promise, as you've seen all those inspiring students from all over the world who've done projects like this has not only made them better people, but it has changed the definition of what success means in their brains, but also the idea that they too can impact and make change in the world. So for everyone listening at the moment, I think this is a call for action for all of you. And you should get in touch and propose some new ideas, propose projects, and help us co-design the international student movement, help us reach new heights, and help us develop small projects that impact people's lives from all over the world.
Fantastic. We'll do a last round of final thoughts, and I'll go to Mike. And I wanted to talk to Mike about, there's been a piece come in here about showing, collaboration between primary and secondary care. And this is a huge area, and also building trust. And if we look at the COVID situation, how we've managed to break silos to accelerate the vaccine, shall we say, process. What an opportunity for social prescribing to show that, across all boundaries, patients, clinicians, managers, voluntary sector, education, and the business community can now have an opportunity to come together to bring solutions to the table that actually have meaningful impact that improve people's health and well-being. I mean, can the UK be the driver of that change?
Yeah, yes, I think I'd go as far as to say it will be. We're about to see a change in the health service to stop it being about competition between hospitals and primary care. And I think that collaboration and the new integrated care organisations will be there. We need to make sure that it's grounded in local communities, that it doesn't become dominated by the acute sector. But if we get it right, yes, I believe that we can work acute care and primary care, which have never really spoken to each other any more than medicine has ever spoken to education. We can begin to get these connections. And once we get that connected at community level, we can make massive change, especially by mobilizing that goodwill we've seen during COVID, all those volunteers, which we need to keep, and we mustn't literally go back to, if you like, normal working when COVID's finished. So I believe it can happen, yes, Gareth. And I think that what I'm hearing from the students today is a groundswell from the younger generation of intolerance to simply carrying on the way we are. And I'm afraid too much amongst my generation, we simply do the day job, get home, and frankly, that stress of doing that's enough without thinking out the box. Here we're hearing a younger generation that's thinking out the box, that's actually doing stuff, leading by example, and I believe that revolution will be strong enough to make all the things you've just mentioned happen. Yes.
Fantastic. Anya, final thoughts from you from an occupational therapy perspective, and also I suppose you probably have some thoughts around how we join social care into this.
Absolutely. I'm aware I'm sitting here kind of saying, well, don't forget AHP. And actually, there's the whole world of social care, which are probably also having to do that as well. I think it's been really inspiring and really exciting to hear kind of all of the work of students. And earlier we were talking about kind of expanding the evidence base of this. And if we think about that kind of like magic triad around kind of evidence-based practice, we've got kind of these professionals, up and coming students who really kind of understand this. We've got a kind of an emerging evidence base as well. And I think over the next kind of 12 to 24 months, if we can really start to make all that co-production that we've talked about genuinely involve people who've been using social prescribing services as well, and their expertise of having been referred, of having using these local resources, then I think this could be really, really exciting and translates across to all types of conversations, active signposting, as well as those very specific conversations that link workers will be having. So it's a specific activity, but it's also that underlying principle of all of our interactions in healthcare. And I think as OTs, allied healthcare professionals, well, actually, no single profession has got a monopoly on person-centred care. So I think it's going to be part of our day-to-day business, as well as very specific activity. And I think that's really exciting.
Daisy, some final thoughts from yourself? Exciting times?
Yeah, really exciting times. And my final thoughts, I'd just like to reflect on a comment made by Chantel. She said, conversation and feeling cared for is a good start towards feeling in control when things are out of control. And I think that's one thing that's really come to light during the pandemic, is that we as humans, we feel connected when we talk to other people. And obviously that's been difficult during the COVID pandemic. But one thing that social prescribing has been able to offer patients, students, all of us, is a chance to connect. So there are some virtual social prescribing activities that have been carrying on. So virtual make a friend phone calls and activities such as this. And it's very exciting to see how social prescribing will help patients during the pandemic and in the future as well.
Right. Bogdan, last word to yourself before I do a roundup. And we are all social beings, as Daisy mentioned there. Huge opportunities for ourselves in the future to lead change in the UK and then to spread that globally through the Global Social Prescribing Alliance.
Absolutely. Well, I think my final thought is that this provides a lot of hope. I think it is highly inspiring to see, especially during the pandemic, where we tend to look outwards. I think we should look more inwards. And what Chantel and Daisy were saying earlier is highly important. And I think it is going to happen. And I think we can all work together and to propel this movement forward. In terms of a few opportunities, I think, and keep your eyes out for them. There's a few webinars that the Social Prescribing Champions team will be leading over the next few weeks. There's Social Prescribing Day, International Social Prescribing Day on the 18th of March, where we say thank you to everyone who's made the COVID-19 situation bearable through various initiatives, be it English National Opera, Breathe Project, or all the fascinating initiatives that people have been doing around there as well. We will have a few follow-up conversations, which Gareth will mention in a second as well. But I do hope all of you watching and listening take this opportunity to get in touch. And I want to end with something that Anya mentioned, which is crucial from my perspective. I think one of the indirect goals of this is to get together and to support each other and to work in collaboration with people around the healthcare sector. It's not about one discipline, it's about all of us. And I think rather than pointing fingers and saying, that the patient's under your discipline, no, the patient's under you, I think we should all just share that mutual responsibility and collaborate together, create healthier communities, create healthier habits, and create healthier values and behaviors in the future generation. Thank you so much all for joining us as well. Over to you, Gareth.
Thanks, Bogdan. Well, look, I'm going to close the session. It's been a fantastic afternoon, evening, morning, wherever you've joined us from. You can, of course, watch this again on our YouTube channels, and it'll be on a podcast on Spotify, Amazon Music, and so on and so forth. As Bogdan mentioned, this is just the start of our Global Social Prescribing Alliance work, where we're going to work across the world, bringing people together, collaborations, being solution-focused, looking at how do we improve people's health and well-being. And we'll also look at, in the future, hosting other webinars over the course of the next 12 months. I will just like to say, finally, thanks to all our guests, to Mike, to Bogdan, Daisy, Anya. It's just been such a pleasure to host this. And we do hope you can join us in the future. And most importantly, look after yourself during the pandemic. Go easy on yourself. And we look forward to joining you or hosting you again in the near future. So